Dr. LeBlanc, let's talk about some of the options a person has if he has a missing tooth or two or three in the back or for that much in the front. Much has happened there. Sometimes people now think, or dentists, that the newer options, because they're new, are they absolute better? And then I have heard that that's not necessarily true, that there might just be a different option, but not necessarily replace the old ones. Anyway, you're the pro here. Why don't you tell us what's available for people with missing tooth, and under which give us a little idea under which circumstances which one might be better, and that it's not going to serve as a diagnosis, of course, but
right.
Go ahead.
Helmet, I'm going to go off on a little bit of a different tangent here.
Okay.
With as good as we are able to save teeth nowadays, it may be an odd thing to say, but the best thing to replace a missing tooth is not to ever lose it in the first place. There's so many people that don't understand old silver amalgam mercury fillings, what they do to your teeth. People that don't come in regularly enough, so when we could find a cavity at an earlier stage and fix it very easily. I had a gal in here yesterday in her 20s. She had a tooth that was killing her. She came in extreme pain. If she would have came in 6 months ago, we could have simply put a small filling in that tooth and she would have been good for decades. Now we're looking at a root canal and a crown, and the decay is so bad we're looking at possibly losing the tooth, and then getting to your question about now what do we do to replace it.
So fast. You're talking a 6 months difference making that big of a difference. We're not talking 5 years difference here, right?
No. It can, and it's different. People ask me that every day. How fast does decay grow? It's just different in everybody. I don't like to relate it to cancer because, of course, a tooth isn't nearly as important as a life. But we all know that cancers grow at different rates, different cancers, different people's, different immune systems. So decay is similar in that respect. It's simply put, the earlier the better. Much like with a cancer, everybody knows that the earlier you address it, the better off you are. So just getting things early. I find more than once a week someone comes in and says, well, I have a cavity under that crown. I didn't think you could get a cavity under a crown. So then I go on to explain what decay is and the most common areas. And one of the most common areas that we get decay is around a crown that somebody already has. So again, just getting things as early as possible is the most important thing, and people are keeping a majority of their teeth through their lifetime, and that's why.
Good. Now, let's just say that failed, like with that gal who came in.
I knew you were going to get back there.
With that gal who came in yesterday where maybe you have to replace it. What options do we have here?
Yeah, there's always three options. Sometimes you're limited to the two options. One is something removable. If it's for one tooth, think of a retainer with a tooth in it. The downside, of course, people find this very uncomfortable. They have this thing in their mouth, and they don't like it. So the two best options after that are a fixed bridge, whereas we crown the teeth around the space, and then they put the bridge in. It's permanent. You don't take it in and out. It's very comfortable. It's probably the most comfortable option. It's certainly the most time-tested option. We've been doing that for decades. And it's the simplest option. There's no surgeries. The other option is the implant, and they're getting a lot of press now, and where even 15 years ago, implants just had a bad reputation, but it was a deserved bad reputation. The failure rate was high. The pain was high. Now we're starting to get a much better talk on the street about implants, and there's a reason for that. The surgeons have been practicing a long time now with the implants. The implants themselves, the technology, the mechanics of them have just been greatly improved, whereas the success rates are phenomenal. And I ask people daily, how was that? And the answer that they give me, that I like to give other people, which makes them understand what the procedure's like, is they go, wow, taking the tooth out was harder than putting the implant in. So anybody that needs an implant obviously has had a tooth taken out, or they wouldn't need the implant. So I like to tell them the hard part's over. You've already lost the tooth. getting the implant isn't as hard as that.
Okay. Now, a person comes in, he has that one missing tooth in the back for a bunch of years, and he, for whatever reason, decides that, look, I want to fix it just because I want to chew better, I want to maybe prevent something, or maybe it is that onset of headaches, and that you as a doctor say your bite is out of alignment, basically your jaws are not getting, and that might contribute, whatever the reason might be.
Right.
What would be a couple, 2-3 criterias? Fixed bridge, which is 3 teeth, basically grind down a couple tooth and put a crown over it and hang a third tooth in between, or a one implant. What would be the criteria? Give us like a rule of thumb, which is good for people to kind of go, that's what we should do.
Yeah, well, thank you for asking that, Helmut, because that's what people ask when they come in. What's best for me? And for me, it's real simple. A lot of people get one answer, and one answer only, I find, from a lot of different offices. Our philosophy here at Portola Dental is to look at the situation, and here it is. If somebody has virgin teeth on either side of this space, then I would have to talk to them about implants and say,
what's a virgin tooth? What's a virgin tooth?
Virgin tooth is a tooth that's never been touched. It doesn't have a filling. It doesn't have a crown. It doesn't have a big old silver mercury filling. It's perfect. So then you think, gee, do I really want to grind that tooth down for a crown if I don't have to? And oftentimes the answer is no. So then an implant makes a lot of sense. On the other hand, if the teeth on either side of the space that we're going to hook onto with the fixed bridge already have crowns on them, or they have big cracking silver mercury fillings in them that would really require a crown sooner than later anyway, then a fixed bridge makes a lot of sense, and there's no surgery involved. So those are our parameters, and I discuss it with a patient, and then together we make a decision. And again, as always, the patient's really always making the decision here. I'm just helping them make the decision that's best for them.
Right. Again, on a big umbrella, which probably doesn't hold true with every case. On an average, a implant or a bridge, whether it's a 3-unit or 4-unit bridge, which one holds longer? Is there such data out there in the first place already, or really not? Is it a toss-up and you just don't quite know, or is it a 100% winner? One lasts longer than the other.
Well, you could. It's an argument that you could have, and different people would feel different ways about it. Oftentimes the implant doesn't feel quite as natural as a fixed bridge. If people come in and have an implant on one side, fixed bridge on the other side, oftentimes I'll ask them, which side do you like? And they'll often say they like the fixed bridge side. But teeth can fail. With the implants they're doing today, which are much better than 10 years ago, we don't know how long they're going to last, but boy, they sure look like they're going to last decades. Now, if you have a fixed bridge on 2 good teeth and the patient takes care of them, we all know that a bridge is just 2 crowns with a tooth in the middle of it. A crown can last decades. If it's a good, well-placed crown made by a well-skilled technician, it can last for the life of the patient.
Okay, so they both, frankly, last an awful long time, and consideration which one fails earlier shouldn't be too much part of it, of the decision.
Yes,
not really, because
to me it has more to do with what you have to build on.
Right. Yeah. And I'm sure there are some, sometimes when, that it is a clinical decision and there's no other choice, and the dentist will tell. All right. Now, is it
absolutely
true?
If you have 2 teeth on either side of the implant and they look bad, you go with the implant, for sure.
Is it true that if a person who is, let's just say, a tiny bit more on the slappy side, and I have to be, again, unfortunately, I make an example with me and my wife, just like with chewing, she chews like a cow, and she looks like a little, she's just, maybe that's why she looks skinny and everything, because she chews her food, but let's go to the brushing of teeth. I shower, I shave, I brush my teeth, and she's still brushing. And we do go 99% of the time together into that bathroom, starting our night ritual. So there's just no doubt about it. Would a person with a bridge, which is obviously more difficult to clean, you might need to go under the tooth with those little threaders. Yeah. It's so a lazy, slightly more on the slappy side guy like me, would I have more risk of not cleaning that bridge beautifully, and by doing so get gum disease, which number one is in itself very devastating and might make the bridge fail faster? Is there something to that with this type of people?
I guess the easiest answer is yes, but there's a but after the yes. If you design the bridge properly, we can make it easy to clean. I can say, Helmut, I'm going to make this easy to clean because I know you, and I know you're not going to clean it if it's difficult to clean. A lot of it has to do with genetics.
And how would you know that? And how would you know that I don't easily clean? Because my blood has been built up and I'm never coming to you as often as I should and all that stuff?
By looking at the teeth on either side. If you said to me, I never brush my teeth, I never floss my teeth, and I look in your mouth, and the teeth on either side of this space look fabulous. They look like the rocks of Gibraltar. Then I would deduce that whatever you're doing now is going to work 10 years from now. You just got real good genes. Someone can come in and say, I brush and floss 10 times a day. And I look at the teeth on the either side of the space and I can wiggle them with my fingers because there's no bone holding them in. Well, then of course we wouldn't put a fixed bridge on these teeth. That no matter how hard they try, genetics wins.
Okay. Or the guy's lying. He's not lying. It just doesn't know he's doing a poor job.
Well, there you go. All of the above.
All of the above. It could be some combination of it. I got it. So, so there are obviously solutions, but that does have a factor in it in terms of it is a little more. Basically, the reason a bridge might fail is not so much because of of what the dentist does with the bridge, if he does it good, but the maintenance of it could make it failing, like anything else in life. You know what I mean? If
you have a 50-year-old person and their teeth are looking pretty darn good, you have to make the assumption that they're going to look pretty darn good for quite a while longer.
Beautiful. I love it. Yeah. Thanks for your candid advice. Very refreshing. Thank you very much, Dr. Leblanc.
Thank you, Helmut.